backdrop here, currently wearing a white, black, and blue plaid shirt. Honored to be hosting this part of the conference this morning. And we'll be having an equitable vaccine distribution update with a guest who I am proud to call friend and colleague, Health and Human Services Secretary, Dr. Mark Ghaly. Now that is a name I'm sure all of you have heard or heard about before, but I want to start by introducing a little bit more about Dr. Ghaly. So he was appointed Health and Human Services Secretary by Governor Newsom in 2019. In that role, he oversees California's largest agency and several departments that are integral to expanding health coverage and access for all Californians. Before joining Governor Newsom's team, Dr. Ghaly worked for 15 years in county health leadership roles in San Francisco and Los Angeles. In San Francisco, he was a medical director of the Southeast Health Center, a public health clinic located in Bayview Hunters Point, a community where I also got my career started, where he led the clinic's transition to a patient-centered medical home model of care, expanded specialty care, and addressed issues of teen health, youth violence, food security, and environmental health issues. In Los Angeles, Dr. Ghaly served as a Deputy Director for Community Health and Integrated Programs for the Los Angeles County Department of Health Services, where he directed clinical operations in the Los Angeles County Juvenile Detention System that led the transition of jail health services from the Los Angeles County Sheriff and the Los Angeles County Department of Mental Health into one integrated system of care. Among his most notable accomplishments was the creation and continued development of the county's Housing for Health program, which since its inception in 2012 has supported over 6,500 chronically ill individuals facing homelessness to gain permanent supportive housing through federal subsidies and LA County's flexible housing subsidy pool. Dr. Ghaly was born and raised in Minneapolis, Minnesota, but we're very glad he loves the sunshine and is now a Californian. And he and his wife are actually raising 4 young children, his wife, Christina. Let's give her a name and identity as well. At Sierra Health Foundation at the Center, we are proud partners of Dr. Ghaly's, and his role is leading our response to the COVID-19 pandemic, both educating individuals, but also responding to the distribution of vaccine, which will be the focus of our conversation today. I started out by calling him friend and colleague. He is indeed that, and a person who is an innovator, a forward thinker, and someone who we are fortunate to have leading health and human services in California. Dr. Ghaly, my friend and colleague, you have the screen.
Chet, thank you, and thanks for that warm introduction. And again, it's great to be with all of you today. Thank you for including me and inviting me to participate in this conversation. I think it is the third one I've had the privilege of being a part of. Last year, I don't need to remind you, but I will. We were in a very different place. I think I did a presentation to you all while I was sitting in a small office with poor air ventilation in the State Operations Center, talking about those formative days around our COVID response, about how we were beginning to think about what we always knew was going to be a real wrecking ball for communities typically overlooked, communities of color, communities with fewer resources than many others, that amplified the disparities that many of us have long sought to improve in California and across the nation and the globe. And sadly, so many of those things have played out across this pandemic. I will say, though, I'm proud to be part of a team led by our governor and so many other hardworking people, both at state and local levels, in clinical settings, and among nonprofit partners, and all of you in philanthropy who really have tirelessly rolled up sleeves, sharpened pencils, thought long and hard through many late hours. I've had calls with you all, many of you at late frankly, obnoxious hours sometimes about what we can do, whether it was around testing, contact tracing, supporting isolation. And I just want to open by thanking you a year after we last spoke for the tremendous effort, the tremendous generosity, the tremendous partnership where we didn't always, where we hobbled more than we would like. You were there to help us. And for that, I think the state and me personally are going to be forever grateful. And the partnerships and the friendships, frankly, that have grown have been important. And that leads to a conversation about where we are today on vaccines and a conversation about equity and equitable distribution. We knew, and I'll tell you, a year ago, if you told me we would have vaccines rolling out in California and across this nation to COVID, I wouldn't have believed you. I think the amazing work of the science community to create vaccines that work, that save lives, we're already seeing that. California a few weeks ago flipped an important but under-addressed milestone. We haven't really talked about it, but among our hospitalized patients with COVID, we have fewer in the 70 and older category for the first time over the last few weeks because of vaccines than we do 50 and younger. Now, what that says is vaccines work because we've been so focused on getting vaccines in the arms of older Californians, those who live in congregate care facilities, many who are people of color, low-income individuals who are in skilled nursing facilities and residential care facilities for the elderly. We've done an incredible job protecting those individuals. I'll highlight that it wasn't easy. It came with a lot of focus and attention. It second and third and sometimes even fourth trips back to work on questions and concerns and educating individuals. But we've done an amazing job in those settings and frankly, across many populations of older Californians. But there's still a lot more work to do, but that is the reason we're seeing that shift in what the impact of COVID is in that community, that no longer are they as susceptible to COVID hospitalizations and death. But now our challenge turns squarely to individuals in California under the age of 65. This Thursday, so in 2 short days, 2 days from now, all Californians 16 and over are going to be eligible for vaccines. And what that means is going from 23 million vaccines roughly have been administered in the state, that we're going to have to zoom forward very quickly among this now very vulnerable population to ensure that they are vaccinated. I'll just give you some other numbers so you're tracking. We've fully vaccinated, that's a number, either one dose with the J&J vaccine or both doses with the Moderna or Pfizer, just under 9 million Californians. We've talked to you a bit about our work on vaccinating individuals in the lowest quartile healthy places index communities across the state. Now, over 2 months ago, we dedicated 40% of our supply of vaccines to those communities, largely Southern California, Central Valley, a little bit in the Northern California area as well, sections of the state. So it was a real focused attempt to work on allocation of vaccine to those communities. And what it's translated is in some gap closure between those more impacted, often lower income, less advantaged communities versus our more advantaged communities in the state. Still today, only 20% of all doses in California have been administered in that lower HPI quartile, wherein over 30%, closer to 35% of all vaccines have been administered in our highest quartile communities, so the more affluent, wealthier communities in the state. So this is something that we've made some progress on, but not nearly enough. What have we done on top of the allocation improvements and focused? It's been a focus on working with community-based partners. Thank you to all of you for the funding that helped us get a round of CBOs armed to work on COVID, now working with those same groups to make sure we get boots on the ground. Some places I've heard incredible stories in Santa Clara and LA and other places where people are knocking on doors and saying, hey, get signed up, bring your whole family, let's go. Situations which are incredible, but obviously labor intensive. But frankly, what it takes, I often say equity is a hyper local concept. It's not something you can plan from Sacramento. You can't plan from City Hall or from the county offices. You really have to get into the people who are not only equipped with the right message, but are the trusted messenger. So how do we do more hyper local activities like the ones I described? It's going to require funding to CBOs on top of what we've already done to get boots on the ground and knock on doors. We often talk about hesitancy. I'm not going to deny that there are concerns there, but I have also seen the incredible work of individuals equipped with the right message, the right information, break down, quote, hesitancy. And I say quote because we lazily pass it off as hesitancy as though it has something to do only with the person who's thinking about it. But really, we have a responsibility, like we do always, to educate, to engage, to answer the really reasonable questions people have. And we've seen by and large, regardless of skin color or socioeconomic status, that we're able to get people who on day one said no, and on day two or after a few days, we're able to say, yeah, this might be right for me. We saw that in our long-term care facilities. We'll see it in our communities across California as well. We also understand the need to focus on making vaccines more available in the sense that they're available at convenient locations, mobile clinics, mobile vaccine sites, working with those clinic partners like federally qualified health centers or community county-run clinics, etc. Are strategies that we hope are going to take our roughly just under 2 million adults in our lower quartile communities who have been fully vaccinated, and we work much faster and much sort of rapidly to get to the full number of individuals in the lower quartile. About 8.5 million eligible Californians live in these communities. So how do we work to ensure that we get from 2 million to 8.5 million as quickly and thoughtfully as possible? So a lot more to talk about. Chet, I want to turn it back to you. I can go on forever, but would love to go into some questions and then hear from those people on the Zoom as well.
Thank you, Mark. Really appreciate the update. Let me just say to folks who are participating in this conference that if you have questions, please put them into the chat. They're going to be forwarded to me, and it's kind of summary so that we can get to as many questions as possible, and I will pose them to Dr. Ghaly. So if you're interested in asking a specific question, please do so in the chat. Mark, you've made reference to the progress that is really being made and acknowledged some of the hurdles, I think, coming out of the gate, so to speak, that California and other states across the country, every jurisdiction has actually faced. Great news, 21% of Californians fully vaccinated, 39% have gotten at least one dose of the vaccination. But what key hurdles do you see ahead in order to get to some of the specific populations that you referenced? The elderly, folks who have a lack of technological access, communities of color, and the disabled. So you think about some of the key unmet needs as you move to a much more case managed approach to making this happen, authentic messengers and folks with real walkabout in communities. What do you think would be really helpful, and how could the philanthropic sector be supportive of those efforts going forward?
Well, sort of as I alluded earlier, I see this as a hyper-local opportunity. We know that there are trusted groups in many of the communities that have popped up. We don't know all of them as well as we should, but we know they are out there, and this is our chance to really engage those individuals. And as you said, authentic messengers who know the doors to knock on, who know who can knock on the next door as well. We need to find a way and do it quickly, because there is this little bit of a race going on between the potential surges in the Midwest and the East and Europe making their way here to California, that the more people we can get vaccinated, even with that first dose and on the road to get the second, is going to save lives in many of the communities we worried about. So in my mind, it's how do we get individuals resourced up to do that door knocking, to make sure that the mobile clinic is there to protect the appointment. And the more, I don't think you can have too many people doing that work right now. And sadly, but fortunately, we have a lot of people looking for work who are well equipped to do this. And even if it's temporary and it becomes the next thing, we should be engaging them in a meaningful way. And I know the state's trying to think through how we do that, and would love to hear from all of you either today or later how we make sure that that happens even more.
You know, we love the idea of kind of community organizing for vaccine equity, right? How do we get people out there in the right places, in the right spaces, those known actors, and really kind of pushing that message and creating navigable pathways to actually getting a vaccine. I know you've been championing that approach, and it's really much appreciated. Here's your first audience participation question. What are some strategies to increase vaccination rates among vaccine adverse or seemingly science adverse populations?
Yeah, and we've done some polling. We've followed other polls, and different populations respond differently. But one of the, I think there's a variety of things that people have found engaging. One, we all want to see communities protected, families protected, and especially on Latino and African American populations, the polling shows that the connection to protected, safe families and safe communities makes a difference, that it's our part. It's not just what the protection does for ourselves, because so many people are less worried about themselves in these, worried about their families and communities. That's one thing. So the message of what this allows us to do for our communities and families by getting vaccinated is, I think, deeply important. The second thing is really understanding what vaccines will do to allow us to move towards this June 15th goal of having California return to a more normal semblance of our business economy. I think so many people have made this false choice between public health, or dichotomy between public health and the economy. They work hand in hand. You don't do one over the other over the long run. They need to go together. So how do we see this as a tool to keep our communities going economically, our own jobs, and our own economic resources moving forward? And then the third area that I highlight, and we're going to be talking more about this in the days and weeks to come, is the role of vaccines in supporting schools, and schools having a fall or a late summer that looks something more like what we used to have, right? Kids having the opportunities to be in school full-time with the option to participate in some of the activities so many miss, to support their development, their behavioral health, mental health, emotional state. I think vaccines is going to increasingly play an important role in that place in our messaging over the weeks to come. So those are three things that I think resonate with a lot of communities that we need to use more and have it come out of the mouths of people who believe it and are neighbors to those who might be considering getting vaccinated.
You know, increasingly we're seeing or learning about the political divide about to getting the vaccine or not getting the vaccine as well. I know you talked about authentic messengers and people who can communicate with people, and I would assume that's something that could be applicable even to folks who may be of certain political persuasions and so forth. Was there anything that you'd want to add if you were thinking about this kind of emerging political divide around vaccine or not question that's being raised?
Yeah, I mean, we've talked about work with some of politicians in particular who might be effective messengers to their constituents, those who voted, on a different side of an issue or a different side of the aisle. We also know that it's important to, and we have more and more data about who's being hospitalized and who's being impacted today. And it's an overwhelming data point that those who are getting hospitalized and getting sick with COVID today are people who are not vaccinated. Vaccines do the job, and amplifying that message, I think, speaks to many, many people who were otherwise not interested. I think as we get more deeply into the conversation and get away from the politics of vaccinations as much as we can, I think we're going to see some improvements there. But I also know from prior work on childhood vaccines as a pediatrician that we have a pretty high wall to climb on that, and we're going to need to engage way beyond the clinical or physician community to get that message across effectively. This is also a chance to mention the importance and the connection we've had with some of our faith-based partners across all sorts of communities to help on the message of vaccine. I know we talk about community-based organizations, but also we've had a lot of mobile vaccine clinics at churches and synagogues and other places of worship that really help amplify to a very diverse group of Californians the need to get vaccinated.
You know, Mark, I know this work is really having a real impact that you just described and that you and your team are actually leading. I visited a couple of vaccine sites in the community several weeks ago. About 50 people showed up. This week, I was back at one in Del Paso, one of those HPI communities. 900 people actually showed up. So we're seeing really a real change and shift in people's willingness to go out and to engage and find a pathway to get vaccinated. You reference, a shift that's coming, a big pivot, 16 plus, now younger people. Anything that you want to say or pull back the curtain a little bit about, how or what your thinking is about that and how that will actually roll out?
So I think a number of things as we've been moving age of who's eligible, we've been increasing the network of providers who are able to provide vaccines. Now really having a serious, well, not serious, but more full conversation around the pediatric and family practice vaccine networks so that we can touch, anticipating that soon we'll have Pfizer vaccine for 12 to 15-year-olds and its impact on schools. So really sort of trying to move methodically so that we're never behind on eligibility. Pretty soon, eligibility and frankly, supply of vaccine is not going to become the issue in California. It's going to be how do we work to communicate and really focus our energy on the education part, the access part, the convenience piece of getting vaccinated. So all of that is where we're heading. And as we make that plan and look to the next many weeks, we're sort of talking right now about the next 8 weeks before June 15th, where we have fuller reopened California, this as a real vaccine sprint and getting through with eligibility rules, building up the network are two important, frankly, I'm going to say easy steps in the sprint towards June 15th. Now the work gets focused on how we do better on equity, how we do more in communities that are often overlooked and underserved. So that's the piece where we're sort of looking forward to that. I will tell you that we're trying to build up a network of providers in California to get anywhere from 3.5 to 4 million vaccines done in a week. Right now, we're definitely having weeks where we do more than 2.5 million vaccines across California in a week. So we want to get that up by about 50 to 70%. And part of it is expanding eligibility so that we make sure we have enough demand moving forward.
One of the things I've heard you say before, Mark, that I'm really committed to, and I know I'm sure my colleagues who participate today would be, is to really have this equity question show up, or this goal show up as we think about the 16 and older population and younger adults as well. And we want to be as mindful of that going forward. I don't want to say much more about that. I think you've spoken to that pretty thoroughly. I do want to ask you about this issue or question, concern about variants, and how that's disruptive what's now becoming a more well-oiled process for getting vaccines to communities across the state of California. And then you throw the emergence of these variants into that particular mix, clearly raising some concerns. Could you speak to, how or what responses you see as being really important to consider going forward?
Yeah, so the challenge, first off, variants are not a surprise. RNA viruses like the coronavirus, especially early in their life cycle, they mutate frequently. There are so many mutations that are silent and don't make a difference that we never recognize them and pick them up, or they don't make the news. But the fact that we have a handful now that are generally circulating across the state or the nation or the globe is not at all a surprise. But what that does is require us to ensure that people get vaccinated and fully vaccinated, because the way that these variants take off, take hold, become even smarter than the ones that we've seen is through transmission. And the best approach we have, especially in a set of communities in a state that is really tired out. Nobody wants to see more general restrictions. I get lots of emails every day asking us to rethink the mask mandate, things like that. I think where we look at the variances, the reason we keep some of these things in place is because we need to get as many Californians vaccinated in the face of variants that are spreading, mutating farther, and hopefully not gaining an edge on vaccines. Because our biggest worry is the variants escape the vaccine's effectiveness. And we have not seen that to an appreciable degree. There have been threats and concerns in other parts of the globe, but not here in California. The vaccines work. Some of you probably picked up that as we look forward to reopening more, one thing the governor has said, and I've tried to amplify it, is we have to change our approach if we suddenly see a lot of people who've been fully vaccinated getting hospitalized. So these variants are really our focus on the transmission side, because we know that so far, even with the variants, but the wild type virus, the vaccine is very, very effective and helps all three do a tremendous job at preventing not just some degree transmission, but serious disease. I will say, just because it would be wrong, wrong if I didn't mention just for a moment the news about the Johnson & Johnson vaccine from this morning. We took that very seriously as soon as the FDA began making some points about this last night and into the morning. We quickly asked all of the providers with J&J to hold the administration of J&J for the time being until we brought our own scientific work group together to assess the information. The good news is the federal government has a group of 12 experts who are coming together right now as we speak to have a conversation about what this information means from the Johnson & Johnson adverse events, coagulopathy, or an issue around clotting and creating some blood clots in major vessels that have led to some bad outcomes and one death. They're looking at it very closely. The good news is the national committee of 12 people include 3 people who are on our safety committee here in California, so a disproportionate share, reminding us that we do have the leaders of the nation here in our state working for us. So over the next 24, 48 hours, we will have a more definitive understanding both on clinical guidance on what to do if any of the current adverse issues are picked up in the clinical setting, but also what the recommendation is moving forward with the Johnson & Johnson. I'll just say that this is going to have an important impact on messaging, on working with. The first thing out of people's mouths this morning is, as concerned as we are about these outcomes, we are worried about what this is going to do on the crusade to create clear, acceptable messages around vaccines. So I do think we want to reserve the right to come back to you with some of our best thinking on how we support working through that issue. Not a shocking issue that we have something like this, but certainly the timing isn't great given the work we see needing to happen over the next 8 weeks.
Dr. Ghaly, let me thank you for your time this morning as we come to a close. Really appreciate it. Look forward to follow-up conversations as things evolve over the next coming weeks. But just really want to say on behalf of Southern California grantmakers that we are very appreciative of you spending some time with us today.
Yeah, as always, Chet, thank you personally, and thank you to all of you for inviting me and keeping with us. I know we came together to work on other things before COVID, and I'm looking forward to the next many weeks of continued success on our vaccine effort and getting back to so many of those issues that keep moving forward. But I think well, looking forward to focusing on those with you as well. So thank you again.
Thanks, everyone. Have a great rest of your day and participate in the conference.